Have you ever pondered why some infections are getting harder to treat? In the microscopic world that exists beyond our sight, there's a battle raging. It's the battle between medicine and microorganisms. And in some instances, the microorganisms are winning. You see, there are certain strains of bacteria, viruses, parasites and fungi that have become resistant to most of the antibiotics and other medications we commonly use to treat the infections they cause. These hardened survivors, these medical anomalies, are what we call superbugs. Imagine a villain in a movie that keeps getting up no matter how many times the hero knocks them down. That's a superbug. It's a bacterium that shrugs off antibiotics like a boxer shrugging off punches. It's a virus that laughs in the face of antiviral drugs. It's a parasite that simply refuses to be killed. In essence, superbugs are microorganisms that have outsmarted our strongest medical weapons. Now you might wonder how these superbugs come into existence. Well, the answer lies in a natural phenomenon known as antimicrobial resistance. This is a process where microorganisms, such as bacteria, fungi, viruses and parasites, evolve when they're exposed to antimicrobial drugs. These drugs include antibiotics, antifungals, antivirals, antimalarials and anthelmintics. What happens is, these microorganisms change in ways that render these drugs ineffective. Essentially, they learn to resist the drugs designed to kill them. It's survival of the fittest, but on a microscopic scale. But here's the alarming part. The misuse and overuse of antimicrobials are accelerating this process. When we use these drugs too often or incorrectly, we give these microorganisms more chances to learn and evolve. It's like a crash course in survival for them. Thus, antimicrobial resistance is driving the rise of superbugs, making common infections harder to treat. So, what does this mean for us and our health? It's a question that can't be ignored. Superbugs, these microscopic invaders, have developed a resistance to the very treatments designed to eliminate them. This resistance is not a random phenomenon, but rather a direct result of the overuse and misuse of antimicrobials. The implications are far-reaching and potentially devastating. Imagine a world where common infections become untreatable. A slight cut or a minor cold could escalate into a life-threatening situation. It's not just about individual health. The risk of disease spread increases exponentially, leading to more severe illnesses and even death. The fight against superbugs is not a lost cause, though. A significant part of this battle lies in our hands. The responsible use of antibiotics is crucial. They are not a panacea, and their misuse can have serious consequences. In the battle against superbugs, every action counts. Remember, antibiotics are not always the answer.